Don't let somebody now come and say, your usual. And your usual is that thing that you are preaching against, in the open. So, let's go. Let's go on. So, those that drink more than 2 bottles of beer a day, those that take more than 2 teaspoonfuls of salt or 2 cubes of sugar per tea a day, the normal salt requirement is just teaspoon. That's what you need to make your soup or stew. That teaspoon. But our mothers, you see them carry with hand. Boom. Boom. Salt. High concentration of salt will lead to hypertension. Next, please. So, if you have high blood pressure in the range of 160-100 and is not controlled, you are primed for sudden death. If you can pinch the skin or fat from your mid-abdomen or from your thigh for up to 2 inches, you pinch it like this up to 2 inches, you are obese and you are prone to sudden death. Next. Next. Okay, those who are diabetic and their blood sugar is in the range of 120 milligram per day or 6.8 millimole, and it's not controlled, or those that have uric acid high or high cholesterol, these are risk factors for sudden death. Next. So, how do you manage sudden death? It occurs outside the hospital. Please note that if somebody is unconscious and the heart stops beating, he has less than 3 minutes to be alive. If the heart is not touched after 3 minutes and you start reviving that heart, if he revives, there would have been brain damage. The person will become vegetable. He will wake up, he will not remember his name, his family. If you like, be a professor, PhD, all those things are wiped off within that 3 minutes. So when somebody collapses, you must know what to do, even as ministers of God. So I'm going to go through next what we call CPR, cardiopulmonary resuscitation. If somebody just falls down here now, you know his name, John, run, John is not answering. The next thing you do is look whether the blood, there is pulsation here, the carotid, not here, just in the middle of the neck, one at a time. Then remove his shirt. See whether the chest is rising and falling, whether it's breathing. If it's not, if it's handkerchief you have, wrap it around your hand, bend the neck backwards, put your finger, run it there. Sometimes it may just be a piece of meat that blocked it, or those people that have artificial teeth. If you remove it, you may start breathing. But if you've done that, nothing, then as the person is lying on a flat surface, hard surface, on the left side, the heart is on the left side. This is my heart. If you put on there, you can feel it. You give it a thumb. Boom, boom. Nothing. You shout, help, 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 call ambulance. Then you start cardiac massage. Next slide. If you are alone, you will do that cardiac massage for 80 times, then you pause. Then you give him mouth-to-mouth respiration. Put hanky over the mouth 2 times, then you continue. But if you are 2 of you, you do cardiac massage 15 times, 5 times, you wait, the person will do mouth-to-mouth 2 times. 1, 2, 3, 4, 5. Wait, Next. Okay, that is me demonstrating this cardiac massage. You can see it. You must continue until help comes. Next. I don't know whether you can play this video. If you can. Okay. You saw the cardiac massage. You continue until you have this automated electronic device. Not slept for days. See what stress can do. He's hypertensive. He forgot his medication. He was very fortunate. He would have died. He survived, you know. But if we are left in that church, where he was lying there, I couldn't do anything. So we are holding the leg, praying. I said, okay, clear first, clear. So the church didn't have AED. They didn't have first aid box. These are things that we should have, you know. Get 1 or 2 people to train you on that. I train people on those things. And then you have it. It could be anybody. Next, please. So these are compulsory tests you have to do if you are 40, even if you are not up to 40. For women, your wives, mammogram for breast cancer and pap smear for cervical cancer. And that one is almost every 2 years. For male, PSA, prostatic specific antigen for prostate cancer. This is for all. Blood cholesterol twice a year, ECG once a year, liver function, kidney function once a year. You do eye test to exclude lung side, glaucoma, and so on. Then see your dentist twice a year. Next. For people who are 50 plus, they do colonoscopy. Poke an instrument through the anus to look at the colon to avoid colon cancer. And if you are hearing strange voices in your head and you feel overwhelmed with sadness and you feel you are in dark places, That's the time to see the psychiatrist or the psychologist. There's no shame about it. You know? Some young men of God told me one story. The house where they were staying, from 10 o'clock, they're getting around 10, 11 to sleep. They'll be hearing something moving on the scratching. They will pray, they will not sleep. Or they will pray until they are tired and sleep. They kept doing this thing. So they became stressed and came to me. The young people, they became hypertensive. So I said, why are you worried about what is scratching on the roof? Have you gone outside to look at the roof? They say, no. Do you know it was a tree branch that was touching the roof? When the wind blew, that's what gave them hypertension. Fear. They say this witch no go die. You know? So ignorance is a very terrible thing. So next, please. Nutrition. Next. Now, a healthy diet comprises a combination of different foods. Staple food like wheat, barley, rice, maize, yam, potato, they're all our staple food. Legumes like beans, lentils, fruits and vegetables. Then food from animal sources, meat, fish, eggs, and milk. Next. So the connection between nutrition and your heart. Good nutrition and a heart, healthy heart, go hand in hand. For example, a heart healthy diet can help reduce your total cholesterol, that's the bad cholesterol, and lower your blood sugar and triglyceride, and also decrease your blood pressure. Food that is rich in potassium can also lower your blood pressure. Things like banana, pineapple, they have a lot of potassium. They help to lower blood pressure. But if you are diabetic, you don't go and start eating those ones plenty because they have sugar too. Next. Gluttony is a disease. Avoid overeating. You know? When you just see food, you just eat because you saw food. Like I said, the error you made when you are young will visit you as a medical issue in your old age. Medical visitor, they will come and they are not ready to go. Next. So this is when I tell some people that if you want to eat eba or pounded yam, it's one ball the size of your fist. They shouted. But this is the ideal food. You know, 50% is fruit and vegetable. And then 25% is carbohydrate. 25% is protein and oils. That is, at any point in time, you are eating, whether breakfast, just know that 50% is what? Fruit and vegetable. Many of us have failed in that. Next. That's what I meant here. Your plate should contain fruits and vegetables of all colors like that of a rainbow. Next. Now, the title is Let's Close the Kitchen by 7 p.m. Time to put your plate down. It is well known that eating late in the night affects a person's metabolism. But now, a study has found out that it impacts your overnight blood pressure and raises risk of heart attack. So, setting dinner deadline at 7 p.m. The research, which examined more than 700 people, warns against late night dining and points out the possible implications. Eating late at night puts people at danger of heart attack and strokes. You must stop at 7, and then if you eat, you must finish your dinner and wait for at least 2 hours before you go to bed, so that the food can digest. If not, as it's not digesting, the BP will not come down. Naturally, when you sleep, your worries die with you during sleep. Abi? BP also drops by even 10%. But with the food in your tummy, the tummy is working. Blood is going round at a high rate. The BP will not, in fact, it will go up. Next. There's what they call KPP diet. K stands for king. So for breakfast, which should be taken between 6 and 8 a.m., you eat like a king. How does a king eat? He has all the food. A king has everything. You know, when you have food in your house, you are not hungry, isn't it? It is when you don't have food that hunger comes. So the king will just pick apple. One apple, orange, banana, you know. Then maybe 1 or 2 slices of bread with 1 egg and coffee. That's breakfast. I was in Ekiti for one wedding. In the morning, the girl was pounded yam. I said bread. They said bread here. Afternoon, pounded yam. But you see, they are farmers, so they burn out their own. But people like us who are sedentary, I found it difficult to, you know. So next. So the king is, you eat like a king in the morning. You're not much. Eat like a prince for lunch, and lunch will be between 12 and 3 p.m. A prince knows that the father has all the food. So he is the prince that caused problem in town. He will carry his father's fast car and go and be causing trouble. So that's the time you eat all the heavy meal, pounded yam, amala, fufu, whatever. But 1 wrap, then vegetable, fruits. 1 wrap. Start trying it. Start. If you are eating 4, okay, start by removing 1. Next week, you remove the second one. The 3rd week, you remove the 3rd one. Your tummy will be adjusting, you know. Next, you know, in the evening, you eat like a pauper, like a poor man that doesn't have food. You can make small pap, 2 you know, medium-sized spoon for beans, stew, then with tea or whatever, or plantain, or 2 pieces of yam. Don't shout to 2 pieces, 2 slices. You know, or you make pap with kose, with 4 or 5 akara. You know, you eat like a pauper. Light, I must eat before 7 p.m. so they can digest. You know? Next. Next, move on. Okay, see the outcome. The person that is eating pounded yam during the day, during the night, you see where the thing is deposited, the man becomes pregnant. But when you eat, like I said, you will be well balanced with small exercise. Next. In the beginning, brethren, because maybe your father didn't take you out, you now decide you take your children. KFC, Mr. Big. It's not that they should not enjoy this kind of thing, but let it not be routine. That was in the beginning. Next. Finally. It's the same boy. He has become adult now. So poor diet is one of the leading cause of heart attack, high blood pressure, cholesterol, obesity, diabetes. Next. Next. Okay, this is negative effect of obesity, limited mobility, bone problems, deep vein thrombosis, high cholesterol, diabetes, high blood pressure, breathing problem, heart attack, low self-esteem, depression, low life expectancy. That's what obesity can cause. Next. Yeah, next, physical activities. Next. Okay, next. Oh, the color is not showing. Okay, but exercise is free. Exercise is free. You don't have to pay for it. You need to do aerobic exercise 30 to 60 minutes, 3 to 5 times a day. You can walk. You can walk. And if you have timer, pedometers, if you walk like 10,000 steps, 10 to 12,000 steps, that's like 5 kilometers a day. That is the only exercise that will make you lose weight and bring down cholesterol, bring down blood sugar. Don't say you don't have where to, even in your bedroom. You can walk from here to here, just keep walking. Just keep walking in the parlor. Sometimes I walk from my sitting room to my bedroom. There's a small step I climb, go up. I just keep doing it. Time myself. You don't need to have treadmill. It's free. Physical exercise is very important. Next. So, benefits of exercise: it will reduce stress, it will reduce blood pressure by 5 to 10 millimeters of mercury, it will reduce weight, it will improve your circulation, it will boost your mood. I've never seen anybody who exercising who is sad, because there are hormones that are released that makes you happy, endorphins, It improves your overall health. And aerobic exercise include jogging, brisk walk, swimming, bicycling, or skipping. Next. 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 For smoking, all I will say there is smoking is not in the lifestyles. You must not smoke. Cigarette smoking is associated with increased blood pressure, increased heart attack, peptic ulcer, and laryngitis, and finally, lung cancer. Next. You can see the lung of a smoker, the lung of a normal person. Even in death, you can see. These two people are dead, though. If you had to go and buy any of this one, will you buy this thing? You can see the smoke. Even in death, the non-smoker's lung is still glorious. Next. Okay. Now, let me talk to our people about sex and sudden death. As you're getting older, your ability to last long or do many rounds reduces. Please, it's a normal phenomenon. Note that at the time of orgasm, your heart rate increases by 50%. Assuming it was 100, it will get to 150. Then the BP will increase by 100. So you can imagine somebody whose BP is not controlled, maybe 170 over 100. Then at orgasm, the systolic will get to 270. You see why men die during sex? In Abuja, I've certified like 5 people dead in the hotels. A man who is 65, 70 will carry a 20-year-old girl. So, you must, at that time of orgasm, somebody having sex with his wife is routine. It's like the heart will do half a kilometer run and then climb 2 stairs of step. That's the work the heart does at that moment. But somebody doing with somebody pick somewhere want to impress. At the time of orgasm, it is like running 1 kilometer and then running up 6 stairs of step. And somebody with a BP of 170 has increased. The heart is stressed. That person may end up with stroke or heart attack. The other thing is using sex-enhancing drug. When people who are hypertensive come to me, the truth is that high BP will make you to have erectile dysfunction. Even the medication will also reduce the erection. But there is something we give the person that will help the person to maintain normal erection. But the BP must be normal. But there are a lot of things they sell in the street. You say if you take it, it lasts long. Okay. You take it. Instead of lasting 10, 15 minutes and rest yourself, 1 hour, you never come. You are battering that heart. You want to come, you can't come. And you don't, what's the essence of doing this thing without coming? That's what is in your heart. You must come. I want to warn our people, those things they come and recommend for you, go and see a doctor to give you a correct prescription after testing you. Many people have died. In Port Harcourt, a man, a contractor, they were owing him a lot of money. They suddenly paid him. You won't believe it, the same street he lives. There was one hotel there, I checked in there. Very irresponsible man with a young girl. As we were doing it, he has stroke. The girl ran out. But security caught her, and they now took him to the man. So I was then a young registrar. This was 1994, before I left for Ibadan. I was on duty when they brought this man. They were reeking of alcohol. He was still conscious. He told me the truth. He was doing it when this thing happened. The girl was saying, harder, harder, harder. You know? You are my palliative. Yeah. Please, next slide. Let me just show you what the kind of things. Next slide. Next slide. Next. 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 I've talked about this. These are commands you do not obey. Harder, harder. Jack it, man. Hit it deeper. Faster, faster. Don't stop. And your palliative, loot me. Shift my womb. You hear all kinds of things. I'm talking to men. You know? Look. A woman is a work in progress. Where you stop, another man continues. Even if you started it, another man may continue. Sometimes you didn't start it, so you joined, and you may leave. You are the one, harder, 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 faster. The man told me he was trying to impress the 19-year-old girl, and then he had stroke. And they are taking a lot of alcohol. We did a CT scan, he had hemorrhage in the brain. The brain busted, the artery in the brain busted. But he called a 17-year-old. We sent for that one, that is his son. He told him the truth. He said, but don't tell your mother. When the wife came, I was listening to the lies they were fabricating. He took a little wine. He was crossing the gutter. He can't hit his head for, you know. That's why. But he died because the hemorrhage was too much. We tried to control it, tried all we could. It was too much and he died. So, please, sex-enhancing drugs will not make your cells better. it will actually affect your heart. As you're aging, age gracefully. If they call you 2 minutes noodles, fine. Let them go and look for their 1 hour beans. You know when you boil beans, it takes a long time. Let them go and look for 1 hour beans, man. Be your 2 hour, this thing. It's between you and her. Nobody knows outside whether it lasted 10 hours. There's no medal to be given. It's not an Olympic game. Next. You can see it. In the event of your sudden death, someone else will continue the work. So a word is enough for the wise. Next. So I'm rounding down. We're encouraged to, eat correct diet. Our diet should consist of 50% fruits. Do aerobic exercise 30 to 60 minutes. Take adequate sleep. Minimum of 6 hours is enough for adults. And the key to healthy living is self-discipline. Next. Now, stress can be destructive if not recognized on time and tackled head-on. Stress problem can present as acute or chronic condition. The effect may present as physical or mental illness. Stress can be evaluated using interactive tools and stress journal. Now, you already have the skill to manage stress. You may have managed stress successfully before. You can always do it again. You must understand that change is inevitable and new challenges will always be there. Don't let changes itself derail your best stress management. Remember, during the times of extreme stress or crisis, or when self-care measures are not working, consider getting professional help. Next. You handle stress like a dog. Handle everything like a dog. If you can't eat it or play with it, just pee on it and walk away. That is run from it. Next. Key to healthy living and avoidance of sudden death is you must put a leash on yourself. How much you eat, what to do, and all that. Next. Well-being is the final outcome. These things must balance. Your spiritual well-being must balance with your physical well-being, your intellectual well-being, your emotional well-being, your social well-being, and your career well-being. They must all be balanced for you to live a stressless life. Next. Can you play this? It's okay. You can stop it. I don't know why it's playing like that there. What we are saying that you must have time to enjoy yourself. You must have time to relax. You must have time. You must put everything in compartment. Part of resting is part of the compartment. So, gentlemen, this is what I have for you for today. Thank you.
One or two questions because in the next 10 minutes we'll be on his way to the airport. If you are blessed, put your hands for the Lord that brought him here. Amen. Be seated, just chop.
Praise the Lord. I have this question to answer. Last year, June, I undergo plastic surgery, but before the surgery, the doctor asked me this question and said, how many wives am I having? I told him.
How many?
Wives.
Wife.
Yes, I'm having. As woman and my wife, how many? And I told them have one.
A thought came to your mind.
No, the doctors.
Okay.
Doctors. So now they now also asked me, how many children am I having? I told them 4. Then I went on the surgery. I did the second one, did the third one. Now my question is this. I don't know why they asked that particular question. How many wives am I having? And how many children am I having? And 3 weeks ago, I just discovered that I began to have chest pain. And I went for a checkup. They said my BP is very high. Why this BP? You know, I didn't give them any answer. I didn't know why the thing became very high. You know, then on me, I was not thinking, I said, okay, let me make myself happy by probably calling my wife to come close to me. But I couldn't actually do anything. And even till I was telling my friend, I'm still having that pain on the chest. And my BP is always rising. What is the solution, sir?
Another question?
Okay, shalom, sir. So, doctor, you don't talk something concerning things like this drink, them, eat juice, they would drink and so on. Personally, me, I be part of it, and because of Christianity, I want to ask if he talk something concerning this energy drink, them, apart from this juice, them, like Bavaria, the Malta, them. So I want to ask if that one we also get anything for do we if it bring down our life, if it disturb we.
Drinking of juice.
Yes, sir, like energy drinks. You don't condemn the one that
energy drinks.
Yes, you know, fine for over drink juice. I understand that one. So I ask now on that energy drinks or
Okay.
anyone they will be prescribed for we will be fine for we for take them.
Thank you. Next person.
Hello. Shalom, sir.
Yes.
Please, I want to ask a question. I don't know if it is proper. For instance, somebody like me during the vigil, I am somebody that once I'm ministering in the night, I take out time to take maybe some like minerals and snacks. Because
to take what?
Minerals and snacks during the vigil.
I think that's
is it
what
proper?
he's saying about
No,
taking soda.
he's asking if energy drink is. If energy drink is okay. But what I'm asking is that in the night, since you said no food at night, let somebody's ministering.
Oh,
that
okay.
you can
Taking
take some
snacks in the night. While ministering, you take a break to go and take some snacks. Next person, that should be the last one because he has only 10 minutes to answer.
Shalom, sir. Sir, I experienced the first time in 1999, stroke year 2000, when we were having crossover at Afijalo, that roundabout. You remember the night at the upstairs?
Your question?
When I heard a voice about 4 people ganging up against you, I had a sign on this side of my head, this right side here, like cold water that night. Since that day till now, I've been having the sign, especially when I'm in the presence of God. So I felt
that's not a medical, it's a spiritual problem. Spiritual doctor Moses will answer that later.
Daddy, wait a minute, sir. A minute. I traveled to India some time ago. I met a doctor friend. He said it's a partial madness.
Oh, okay.
I want to confirm.
Then the medical doctor will answer that. I think that should be all. Yes. Yes.
Good morning, doctor. Please, I want to know what are
people at the back are complaining. Take one microphone to the back. Yes.
I want to know what are the permanent cure for ulcer?
We're talking about stress. You're going to ulcer. Ulcer. Yes, at the back.
Sir, I thank God for your administration. And at the same time, I want to know, you mentioned something about Oyibo food. And this Oyibo food, is it related to GMO?
Oyibo what?
Oyibo food. Food. Yeah, food, not fruit. Food.
Western
FOOD. FOOD, food. Secondly, you talk about salt. I don't know the kind of salt you are talking about that has anything to do with BP, because I come to understand that we have the organic salt and the table salt. Which of these salts is good for human consumption? Another one again, you spoke about, you will watch on your slide about CPR. I could have wanted where this CPR could have done practically, so that we that are novice.
So you mean somebody can collapse here?
No, not collapse.
Then they practicalize it.
Yes, not so, sir. I'm not trying to say that he could have, showed us where to put our hand when doing such, such CPR. Last but not the least, what keeps the heart going? What are the nutrients? As in, what kind of food that has to do, that helps the heart going? Because one aspect of the heart, what the heart needs most is fat. So what kind of what? Fat, F-A-T, that makes the heart pump very well and function very well. So what kind of nutritional food do we need to consume to make sure that this heart is well,
God bless you. He will just take these answers.
Thank you, sir. Briefly, sir, you kept emphasizing aerobic exercises. Is there any benefit to the anaerobic exercises, like the weight lifting and other things? Is that also beneficial? Thank you.
So let me start with the person that said he was asked whether he had how many wives? 4 wives. And there are many children. There are many reasons a doctor can ask that question. Because the more wives you have, the more stress in you. Maybe you found some stressful conditions. But you're not talking about BP. Increase in BP, chest pain. That could be the reason for asking you. It's trying to locate what is stressing you. Somebody that has 4 wives and maybe 12 children will be more stressed than somebody that has 1 wife and 3 or 4 children. I think that is the reason for asking that question. They're just looking for a source of what you call stressor. And there are many things that can cause chest pain. But when you have chest pain, please come to the hospital. You do a basic one. If it's for the heart, they do ECG, check your cholesterol.
Sorry. As an incoming call, I watched the stream worldwide.
Okay.
The stream worldwide. Okay, if it's true, then you just bring it in. So we don't take time. Go on, sir.
Okay. So, please go to the hospital for chest pain. It could be due to angina, a heart problem. It could be due to musculoskeletal. It could be due to ulcer. There are many things that can cause chest pain. And they'll carry out some tests and be able to tell you the source of the pain. Okay. Energy drinks are very dangerous for consumption. Please, it contains like 100 times the quantity of caffeine that you take in normal coffee. About 100 times that. Some 50, some 40. So when you take energy drinks, you are taking so much caffeine. It will increase your heart rate, it will increase your BP, and then it will keep you awake. Some people are taking energy drink, they couldn't sleep for 48 hours and become stressed. So you don't need the energy drink to help you do ministry or do anything. Do normal exercise, sleep well, you come out. Maybe I should have taken energy drink before coming here. No. So other drinks. Now, red wine contains what you call antioxidants. Those antioxidants are things that are good for the heart. But alcohol itself is not good for the heart, except at moderate rate, a glass of wine. But when people begin to drink 2 or 3 bottles of wine, it becomes toxic. The alcohol content becomes toxic to the heart. That's what they call alcohol heart muscle disease that can make the heart to fail or even go into heart attack. So, but the antioxidant, you can also get it in other things without alcohol. So it doesn't mean that you must drink red wine to get the antioxidants. They are in fruits. All the fruits you eat. You know. He said taking minerals and snack while ministry. I think there's a saying that somebody that is eating should not talk, isn't it? If you are eating, don't talk.
Hello? Hello?
If you are talking, don't eat. If you're on break, fine. Break, tea break. It's okay. You take your snacks. But I would recommend that people should start producing soft drink, whether juice, because of the sugar content. You don't know the genes you have that can make you become diabetic. So, like when we go for Nigerian Cardiac Society conference, we don't drink soft drink anymore. It's water or fresh juice pressed out. That's what we take. But I know for many young people they still need some glucose, but don't do it too much. So talking about partial madness.
Hello, sir. Good morning, sir.
Morning. Who is calling and where are you calling from?
I'm Sister Patience calling from Kaduna.
Kaduna. Session for Kaduna, yes.
We have a brother that slumped yesterday on Saturday morning, and he is in coma up till today. We took him to the hospital, and there is no result at all. I don't know, because of this program, any advice that doctor can give us.
The person is in coma.
Yes, sir.
Well, if the person is in coma, there are many things that can cause coma. They have to investigate the cause of the coma.
Yes, sir. They place him on oxygen, but he's still not.
Yeah, recovering from coma can take days, sometimes months, or even years. So it cannot predict. But when you find out the cause of the coma, you can handle it. Assuming maybe it's bleeding in the brain, they will have to stop it. I'm not saying that is the cause, so I'm just giving you as an example. So let the hospital people do. I'm sure they know what to do. They will do it. Because whatever we are saying here is just theory. But there are many tests to be done. Blood tests, MRI, CT scan, to find out the cause of the coma.
Let the investigation continue. God bless you, Sister Patience.
So when you say partial madness, you can't. There's nothing like partial madness. It's either you're mad or you're not mad. So I will advise that you see a psychiatrist so that he will assess you, psychiatric examination, whether you're hearing voices, are they voices telling you to fight, or are you seeing strange things? If not, there are a lot of spiritual experience that medical this thing cannot explain. But you can see a psychiatrist for full assessment to remove that. That one is beyond me here now. Okay. There's a permanent cure for peptic ulcer. The person that talked about peptic ulcer, there's a permanent cure. In proper hospital, they do H. pylori test, there's medication they will give you. Maximum 2 months. and the ulcer will be gone forever. You know, the things that many people nurse ulcer, when there are certain things you also told not to take, to avoid until the ulcer heals. Especially in this part of the world, pepper, people eat pepper a lot. You know, so go to the hospital. There is treatment for ulcer. Many people, I had ulcer once, I don't have ulcer now. Treated. So, Oyibo food, when I mean to Oyibo, I mean junk food. You saw the picture of the young boy, you know, eating burger, chips and chicken. All those things contain high cholesterol, you know. And when once cholesterol is deposited in the arteries, it narrows the arteries, the BP will increase. And that is a key for blood clot formation and then either stroke or heart attack. Organic or table, salt is salt. Salt is salt, whether organic or table. You are not expected to take more than 6 grams of salt in 24 hours, that teaspoon. In fact, there are people now that don't eat, they don't put salt. Because all these Maggi you eat, they contain a lot of salt. All these things, flavors you put in the distance, it's enough for some people. You know, we tell people low salt diet or no salt diet, because you will still get it from what do you call them, Maggi and all the stuff, seasonings. Yes. Okay. So CPR. Well, if the church wants to organize CPR, practical one, we have the mannequin, we have the manpower. We'll come and demonstrate everybody. Everybody. We did for the armed forces last year. Army, Navy, Air Force. I was in Ikeja Hotel for 2 days. You know, doctors, nurses, and others. All of them came. They were about 300 people. We did the practical for all of them. They demonstrated and we issued them certificates. We know that if anything happens, these ones are capable of doing cardiopulmonary resuscitation. So what nutrient does the heart need? The heart doesn't need fat. Too. Somebody say fat. The heart doesn't need fat. In fact, fat is an enemy of the heart. I talked about fruits and vegetables. They contain antioxidants. These antioxidants makes the vessels of the heart, coronary vessels, to be smooth. No clogging. Okay? So the best thing, follow the regimen. 50% of your food should be fruit and vegetable. 25% carbohydrate, 25% protein and oils. But once you follow that, the heart is getting the best nutrient. Don't go and feed the heart with fat, you know. Now, aerobic exercise is one that the heart benefits the heart. That is walking, running, skipping, and so on. Anaerobic, like weightlifting, it doesn't directly benefit the heart, but you are developing other parts of your body. But for the heart, aerobic is the key. You know? If you are boxing, you are doing exercise, it's part of aerobic. You know? Swimming. But when you go lifting weight and then doing push-ups, those ones develop other parts of the body, not really the heart. I hope, I think that's the last question. Thank you.
Thank you very much. You know, it was very short notice. Okay, some on the line. From where? Shalom to our wonderful health instructor and our daddy in the Lord for the divine wisdom behind this very important forum. May the Lord continue to... Can you put off this light? It's on my eye, so it's affecting me. Can't see.
Blood pressure is low.
I'm sorry, where did I reach? My mother had been suffering from mental health issues for many years now. He's not a psychiatrist though. I thank God the doctors say she's stable now. The problem now is that her blood pressure, is very low. Despite the medications, and the psychiatrist is advising she goes for heart scan. Please, I need your counsel on this. God bless you, sir. Open from where? Equatorial Guinea.
When there are many things that can cause low blood pressure. One is hypertension that was not well treated in the past. It will cause the heart to dilate. So you call it decapitated hypertension. So the person now has to having low blood pressure. But there are other signs that will be there. You know, breathlessness. He walks a little distance, he's breathless, leg swelling, you know. Signs of heart failure will be there. But again, certain drugs, psychiatric drugs can also reduce blood pressure. So the psychiatrist will know whether the drugs she's taking is the one that is causing the reduction in blood pressure. But when you do echocardiogram, which is the scan of the heart, it will tell us the size of the heart. And then we know whether the heart is dilated. If it's dilated, then you know that is the cause of the low blood pressure. And if you see a cardiologist who will prescribe certain medication that can raise the BP up again.
Thank you very much. We want to thank you. Short notice, just very short notice, he agreed to take this time to come here. I think this is of the Lord. This is of the Lord. This is of the Lord. I'm sure we gained something. We are still arranging for him. We'll get a better timing. Maybe next year, ministers' conference meeting, we will have more time. We will make sure we are the one that brought him to Lagos, so that he will not share his time with any other place he'll be going to. And all that was spoken today is recorded, so it's already streamed. Go to the YouTube, it's there now. To the Facebook, is there. And in case you don't have the IT, we'll produce it for you, put it on your phone, and then those who have smartphones, and you can keep listening to it. Thank you very much.
A round of applause. Can we be on our feet and just celebrate our